Hello learners, today we are going to discuss something more interesting. So before entering into the topic, I would like to share one of my experience. So one day my medicine professor came to our clinical classes and we were waiting for his lectures. At the time he was asking one question, what is stress? So we were trying our level best to give our answer and we were trying to prove ourselves. But finally he ended up with a simple answer, that is, stress is the distance between what we are expecting and what we are getting in the reality. So in the similar way, today's topic will be between two queries. So the topic is misnomer. So something is named inappropriately. Okay. So what were the queries? This is what we know and this is what it is exactly. So the distance between this is called as misnomer. So here what happens, few medical conditions were named differently but that does not means what is given in its name. So let's see the examples, then it will be easy for you to understand. So let's start with the first condition. So first is white bile. So looking at it, so something related to bile and the bile might be looking white. So this is what we know. So here it is neither white nor bile. So let's see what it is. So it is completely not bile. It is a mucus content and it is mainly because of the obstructive jaundice, and because of the obstruction the secretion of bile from liver is stopped and the mucus is getting accumulated and that passes out. So that is white bile. So it is not white and it is not bile also. It is just a mucus because of obstructive jaundice. Okay. So now let's see the second condition, that is mycotic aneurysm. By looking at the name we might be thinking mycosis is related to something fungus and aneurysm is none other than dilatation of blood vessel. So let's see. So we know it is a fungal but it's not. And what it is exactly? It is a bacterial infection causing the dilatation of blood vessels. Next. Lateral aberrant thyroid. So looking at the topic, we are getting that some thyroid gland is aberrant, placed somewhere laterally. So what it is not an aberrant thyroid and it is secondaries in the neck lymph node from the occult primary thyroid. So in case of papillary carcinoma, we might be getting lymph nodes around the neck and that is called as lateral aberrant thyroid. Okay. Then adenolymphoma of parotid gland. So adenolymphoma, what it is indicating? Adeno is indicating gland and lymphoma is indicating some malignant condition. So this is what we will guess. So it is not lymphoma and it is a benign tumor of the parotid and it never turns into malignancy. Next comes pretibial myxoedema. This I had done mistake even in my personal MCQ sessions. So first, it is not a myxoedema. So myxoedema is because of hypothyroidism. But what it is exactly? It is seen in thyrotoxicosis, which is hyperthyroidism. So it is pretibial myxoedema belongs to thyrotoxicosis, that is hyperthyroidism. Don't commit the mistake which I had done before. Then comes STERNOMASTOID tumor. So some tumor related to sternocleidomastoid muscle. So this is how we will think. Yes, it's not a tumor. Then what it is? It is due to the birth trauma which causes organized hematoma in the sternocleidomastoid muscle. So because of birth trauma, there is some hematoma which appears like a tumor. Okay, it's not a tumor. Next, dissecting aneurysm. So it's like some dilatation of blood vessel and it is getting dissected. This is what we know, we guess. So it's not a dissecting aneurysm, it is an aortic dissection. So here what happens in case of aorta, there will be leakage of blood in the intimal layers of the aorta. Okay, it's not exactly the aneurysm what here it is mentioned. Okay. Then comes malignant HYDATID. So HYDATID, I think you might be guessing that it is related to a parasitic condition, that is hydatid cyst, which is caused by Echinococcus granulosus, also called as dog tapeworm. So let's see, here it is malignant hydatid. Let's see, it's not malignant. And what it is due to Echinococcus alveolarisis or granulosus. It behaves like a malignant condition and it's not a malignant condition. Next, malignant exophthalmos. So exophthalmos we all know, and here it is mentioned as malignant. Let's see. It's not a malignant condition, and what it is? It is due to primary thyrotoxicosis or hyperthyroidism. Next, SPINA ventosa. So by looking at the name, we might be thinking it is related to the spine. So let's see what it is. It is not related to spine, and exactly what it is. It is tuberculous dactylitis. Dactylitis is none other than the inflammation of tendons of fingers and toes. So it is tuberculous dactylitis, which is also called as spina ventosa. Then comes mycosis fungoides. So looking at the name, we might be guessing already it is mycosis, so fungus, and second name is also fungus. So it is completely related to the fungus, what we will guess. But it's not a fungal infection. It is a cutaneous T-cell lymphoma, and there is a syndrome associated with mycosis fungoides. If anyone know, kindly comment below. We will continue the discussion with that topic. Then comes hypernephroma. So with the name we can guess something above or more. Hyper is indicating that, and nephroma is indicating nephro is indicating kidney, and oma is indicating some type of tumor. So let's see what it is. So it's not above the kidney. So what it is a renal cell carcinoma. Okay. So with the help of OMA, we might be thinking benign condition, but here it is indicating a malignant condition, that is renal cell carcinoma, hypernephroma. Then hepatoma, here the same logic applies. We should not go with OMA, which is benign. It's not a benign tumor, and it is exactly hepatocellular carcinoma. So in case of hepatocellular carcinoma, there is one more clue that jaundice is very rare in HCC. Then melanoma, simple, same logic applies here. It's not benign, it is melanocarcinoma, which is a malignant condition. And here there is a mnemonic A, B, C, D indicating the structural formations of melanoma. So if anyone knows, kindly comment below. It's like a quiz. We will have a healthy discussion over there. Then surgical ganglion. So something related to surgery, and ganglion we always remember it related to the nerve. So let's see. It's not from nerve ganglion. Then it is arising from the synovial sheath, and we all know here appears mostly in the dorsum of hand and around the wrist region. We can get this ganglion. Ganglion is none other than the cyst arising from the synovial sheath or tendon. So these were the interesting topics which we thought to discuss, and if you have any topics to be discussed, you can comment below, and you can comment the answers which were asked previously. And thank you so much. Happy learning with us.